Hi, my name is Charles Hardy, and I'll be presenting the Four Corners disease, other known as hantavirus. What is the Four Corners disease? This was a virus that became pronounced in 1993, and you obtained it by coming in contact with rodents and their waste. Hantavirus is called New World hantavirus in America, but in other places it is called Old World hantavirus. It was called New World hantavirus in America because it may cause hantavirus pulmonary syndrome. It was called Old World hantavirus because it was mostly found in Europe and Asia and could cause hemorrhagic fever and renal syndrome. How is it spread? Four Corners disease is spread by mice feces, which is their waste. It's spread primarily when the virus particles from rodent urine, droppings, or saliva are stirred mixed with the air. For example, since mice are known to be in barns, it is best to wear a mask when cleaning one out since you will be sweeping and the dust particles will be put into the air and you can breathe in those virus particles, which will go into your respiratory system. Symptoms. Early symptoms are fatigue, fever, muscle aches, which include the thighs, hips, back, and shoulders, headaches, dizziness, chills, and a plethora of abdominal problems, which is nausea, vomiting, diarrhea, and pain. Late symptoms are 4 to 10 days after the first sign of virus, you can start to develop the signs of HPS. You start to cough, and that follows up with a shortness of breath, and your lungs start to fill up with fluid. One person who survived the hantavirus said, "It felt like a tight band around my chest and a pillow over my face." So they basically felt like they were being smothered. And this right here just gives you a brief overview of how it spread, the symptoms, and characteristics. So, some symptoms, like I said before: chills, fever, muscle aches, dry cough. Characteristics cannot be spread between humans. Survival rate. There's a chance that hantavirus can kill you, and that percentage of mortality is 38 to 40%, which is pretty high. It starts off by being a flu-like symptoms and then progresses from there. The severe respiratory failure is the reason for most of the resulting deaths. So how do you kill it? Since hantavirus is able to survive in environments for only a few hours, which it's usually in dirt, dust, and in rodent nests, it's still able to be killed before it eventually dies out. You can use household disinfectants, for example, bleach detergents and alcohol. Hantavirus can also be killed by UV rays, which comes from sunlight. So treatment, there really isn't a treatment or cure for hantavirus, but there are some things you can do to help combat the disease. If you catch it early, you can receive intensive care, and the patient is intubated and given oxygen therapy, which can help them during the phase of severe respiratory distress. Prevent exposure. Store foods with tight fitting lids. If you have holes uh, that go inside your home, make sure they are sealed because, like snakes, if the head can fit in, so can the body. Make sure you keep the bushes and grass around your home trimmed, and wood piles. Make sure you keep those away from your home because mice like to make nests in those. And if it comes down to it, make sure you set traps and dispose of the rodents in a clean manner. Fun facts. It's pretty rare to get hantavirus in humans because it dies shortly after getting hit by the sunlight's UV rays. Hantavirus was first discovered in the early 1950s when about 3,000 United Nations troops in Korea were struck by a mysterious disease. Hantavirus can't spread from one person to the other, and the chance of getting hantavirus is 1 in 13 million. And not all rodents have hantavirus, but it's still better safe than sorry. Thank you.